Welcome to the Counterweight podcast. I am Doug Rogers, Chief Revenue Officer and Managing Partner for Waypoint Healthcare Solutions. And I'm joined weekly by my co-host, James Kanary, founder and owner of the Upper Right Corner. Together, we are focused on speaking to and learning from growth leaders across the healthcare space about their journeys and lessons learned. James and I want to explore how growth leaders manage this tension, not only for their teams, but also with their leaders and in many cases, board members and investors. We will discuss with our guests the career journey they have been on, key influences that help them put them into the position they are today. We will talk about successes and challenges, what they learned from these events for themselves and for their teams. Join us each week for a new episode with our guest. You can find us on Apple Podcasts, Spotify, YouTube, Instagram, and LinkedIn under the name The Counterweight Podcast. Subscribe, like, follow, and give us feedback as we go along. Now on to the show. Welcome to The Counterweight. My name is Doug Rogers, and I'm joined by my co-host, James Kanary, and we are excited to have Jay Taylor on the pod with us. We are going to have a phenomenal conversation. I'm just super pumped in terms of where this is going to go, some of the things that we've talked about in our prep session. Jay, welcome. Thank you for making the opportunity to join. And why don't we just start with you telling our listeners a little bit about who you are, the company you're with, the role that you have, and then we'll dive right in from there.
Yeah, great. First of all, just wanted to thank you both for having me. Great podcast. Excited to be here. But a little bit about me and the company I work for, Brave Health. So, I'm the Chief Growth Officer at Brave. We're a virtual outpatient mental health provider. So we provide therapy as well as medication management to the patients that we serve. We're a Medicaid-first business and really focus on serious mental illness, maternal mental health, adolescent mental health, and suicide prevention. So we've been in business since 2017. So telehealth company that predates COVID. We're doing our thing before COVID hit, and then obviously had a huge acceleration coming out of or going into the expanded need for telehealth and kind of ready to take that on. Operate in 8 states today. So Florida, Texas, New York, Georgia, Illinois, Ohio, Oklahoma, New Mexico, and have been, aggressively expanding into new states. In terms of my role as the Chief Growth Officer, really have kind of 2 key responsibilities. One is expanding into new markets, which we've done a lot of over the last couple of years and continue to do going forward. And the second is ensuring that we have patient adoption and that patients are coming through the door and we're able to get them connected with our providers and drive great patient outcomes.
That's awesome. Yeah. I'm really excited to dive in with, I think you'll be our first guest that is leading growth in an organization that's Medicaid first. So excited to hear, because that's a different world. Excited to hear kind of what you've been doing, what you've been learning there. But before we dive into that, what drew you to Brave Health? Why did you decide to join?
Yeah, actually, my very first job in healthcare was in mental health. Really? While I was in college. So my father's a psychiatrist. My mother's a licensed social worker.
So wait a second.
Oh man, I want to be at your dinner table.
About to say, can we just take a tangent and talk about the conversations y'all had? That would be phenomenal.
Oh man, was there did everybody just sit in leather recliner couches?
That's right.
There wasn't like a dinner table. You all just sat around in the leather chairs.
There was a table, but then we all laid, the kids were in the full lay down position and
Absolutely.
I think really the takeaway is that Jay is probably the most self-aware, the most understood person that we've ever had a chance to talk to.
And he's already psychoanalyzed. He's already psychoanalyzed both of us, Doug. And I'm amazed he decided to do this podcast. I'm not sure why.
I am too.
So okay, we're excited for you.
I feel like we took this on a tangent, so we'll come back to the question. Why Brave?
Yeah. So my very first job in healthcare was at an inpatient psych facility. I worked as a mental health associate at an inpatient psych facility. Did everything from led groups, taking vital signs, administering restraints. At 18, 19 years old. So very eye-opening experience. Really got to see what the impact of mental health is and what, the really high end acuity side of that looks like, from when people walk in the door at, an inpatient facility to when they walk out, and kind of that huge transformation that happens, through getting their meds set up correctly, being connected with the right therapist that can help them work through some of those issues. And also saw, one of the ways that our system is failing, where, we have the same people coming back over and over and over again. They're able to get stabilized in that inpatient setting, but we're not providing them with the right supports going forward to keep them from coming back 2 months later, 3 months later, and having that cycle just continue and continue and continue. So, have kind of a deep connection with mental health, through my family, as well as, through that experience. Obviously, Brave being in that mental health space drew me there. But then I think there's a couple of things I think about, as a sales leader in any real role that I look at, because, I think one of the most frustrating things from a sales standpoint is having a product that doesn't have product market fit or doesn't have the demand, right? You can be the best salesman in the world, but if you don't have something that somebody wants, you're just going to be banging your head against the wall. And there's really kind of three core things that I think about when I think about that fit and demand in the market. The first is, is the issue that we're solving, the top 1, 2, or 3 things on the list of the CEO of the companies that you're selling to. Yeah. If you're outside the top of that list, those priorities can fall off, get kicked to the next year very, very quickly. And we all know how frustrating it can be to, be deep in a sales cycle. You've convinced the stakeholders, you're solving a problem, but it's just deprioritized because it's not a top priority of the company, not because of the need, the fit, anything like that, but just where it fits in overall organizational structure. So that's kind of number one for me. Number two is, what are the regulatory tailwinds? And I use the term regulatory pretty loosely when I think about that. It's what's the prevailing sentiment in the market? What's likely to change, or not change, in the future, and kind of what's driving the demand, or, what's keeping you top 1, 2, 3 in that CEO's list. And, when I think about behavioral health, the need that exists in the market across the country, this is something that the U.S. healthcare system is really falling down on today, and not something that's likely to be completely resolved anytime soon.
Yeah.
So a lot, driving from a tailwind perspective there.
So with that concept, as you've made the journey into Brave, certainly I'd love to talk a little bit more about the solution, the capabilities that Brave offers. But when we had talked earlier, prepping for this, I think one of the interesting comments you made is that the sales motion is a little bit different, meaning, at least what I recall, is that you are selling to entities that are then going to enroll patients or something along those lines. Can you talk a little bit around, you're in 8 states, but what is that motion? Who are you selling to? How does that conversation go? And lastly, you said, hey, it's really important, or it makes it easier if the priorities are in the 1, 2, 3. Please tell me, mental health, behavioral health is in the 1, 2, 3 of these conversations.
Yeah, so a lot of this ties back to Medicaid. You mentioned,
Yeah.
you haven't had a lot of these Medicaid conversations. I think, when we think about market expansion, growth, all of these different factors, there's a lot of things at play, especially in Medicaid, when you think about growth and expansion. Medicaid is very local, right?
Yeah.
Every state has their own program. Every state does things a little bit differently. They have their own fee structures. They have their own accrediting bodies, right? So really, the sales cycle and the go-to-market cycle starts with individual state evaluation. So, there's an upstream process, I think, from a lot of software or other or commercial or Medicare go-to-market where, if you have it solved in one state, you can kind of expand nationwide, and there's not too many barriers to entry from that standpoint. Whereas on the Medicaid side, really we need to evaluate the regulatory climate, in each state that we go into, look at the reimbursement that's in each state. We have because we're a care delivery organization and we have to employ providers in order to deliver care. We need to look at what's the cost to service that state. And then there's all of these timeline components that go along with each of those components. As you think about the regulatory pieces, provider enrollment and credentialing, and this is really all before you're even getting to, the traditional sales cycle and sales funnel.
It's a very, you're talking about a very practical qualification of a buyer here. Can we actually deliver the services, the things that we're good at? It's not, do we want to, it's can we actually deliver it in that state due to the reimbursement, the regulatory, the operational, right? And I know during COVID, some of this was relaxed. So I'd love your kind of thoughts on credentialing, right? For mental health, you have to have specific credentials in that state in order to provide care. So you can't just have a centralized call center in Kansas City and provide mental health services to the entire country, for example, unless that person or provider is credentialed in that state. Is that accurate?
That's right. Yeah, it is. So you have a lot of things did get relaxed during COVID, but really that was more around telehealth regulation, where there was some expansion in what was allowed and what was allowed, and while a lot of things have been kicked out, the way the majority of that regulation has been written is it is kicked out. So we continue to see extension upon extension upon extension. It'd be a lot better for us, and I think a lot of the people that are delivering care this way, to not have to worry about, is this door going to get shut at some point? But I think we're now several years post those regulations being put in place. They've now had 2-3 extensions. I think it'd be very hard to put the genie back in the bottle for a lot of these different areas. So that's helped. But we really still have a long way to go from a licensing and credentialing standpoint. You mentioned, and this is how it works, is that in order to deliver care in any state, you have to, of course, be licensed to practice medicine in that state. There's an additional component when you get into Medicaid, is you also need to be Medicaid enrolled in that state. So, there's some things that have happened in the regulatory or licensing world that have allowed MDs to get cross-licensed into different states a little bit easier, where they have reciprocity and compacts that allow you to, if you're licensed in one state, to get a secondary license in an expedited way, a little bit easier in other states. That doesn't exist quite yet on the therapy side.
Really?
So there was some regulation that was passed in January 1 of 2024 to create a compact for therapists to allow them to have that similar thing in place. But the regulation is passed, now it needs to get operationalized. So we haven't actually gotten to that place of operationalizing that. So what it looks like today is there's 10 different license types. Each state has a different name for them. There's several different tests you might have to take. There's different hours requirements you have to reach. So, there is no even one-to-one to say, okay, we know that everybody from this state can easily get cross-credentialed into that state. It's a, person-by-person basis that you have to look at to get people across. So it makes it very difficult to manage demand across state lines.
So I'm gonna go out on a limb, and I think this may be an obvious statement to our listeners, but I think it's worth saying. You don't just have to be a knowledgeable and experienced growth leader. You really have to also be a knowledgeable health policy person. Right? The nuances and the credentialing, the licensing, the regulations, et cetera, in each of these states are so complicated that you have to understand it to then guide your growth efforts, your sales efforts, et cetera. I'm not sure that everyone appreciates that is a responsibility when you sit in this role.
Yeah, well, I think like most people in growth and sales, I know enough to be dangerous in these topics. But I'm fortunate enough to have to work with a great team here at Brave that are on top of all of the regulations, have a really strong understanding of the operations that need to take place in order to check all of the 15 boxes it takes, in order to get there and, keep me honest, as we worry about growth, expansion, and kind of all of those things.
Yeah.
Well, now you're being modest, but as a wise leader once told us, be a student of the game.
Yes.
And that's Dick Flanagan, by the way. So shout out to Flanagan.
We'll put his picture up.
Yeah,
you've never met him, but
Dick
just that picture right over to the side will be great.
Yeah, we have the cardboard cutout somewhere here.
Somewhere. Yeah.
But yeah, be a student of the game. You're a student of the game for the market you're serving, and it's obviously super important from a qualification perspective and aligning expectations. So, huge kudos there.
I want to go back though, and just guide us. Who do you actually sell to? So is Brave selling to the state? Is it selling to a managed care organization or an insurance plan? Or do you go direct to the consumer, the Medicaid recipients, or some variation of those three?
Yeah, so primarily we're our patients get to us, so ultimately we're selling to a couple of different entities.
Okay.
In order to deliver care, we need to be contracted with the payers.
Okay.
So kind of our first sales cycle, well, actually, if we go back to kind of where we were at a second ago, our first sales cycle and funnel is really that market expansion. We need to be able to get into the market and serve the market. The second kind of phase of sales and sales funnel is to be contracted with the payers. So we're working with the payer contracting and care management organizations within the payers to explain our value proposition and what we can do to serve them, and ultimately become in-network or value-based care providers within ideally all of the payers in the markets that we serve. So once we've kind of achieved that market penetration and coverage from a network standpoint, now we have to get patients through the door, and that really is a third sales funnel where we're working to make ourselves known and available to the patients, and we think about that in a couple of different ways, and it's really about thinking about how patients consume healthcare. You have high acuity people that are engaged with your health insurance company, where 2 to 5% of the population has a care manager, is engaged with those care managers, high acuity, high cost, and a lot of them typically have mental illness or other physical chronic conditions that would benefit from therapy, medication management. You have a large swath of the population that's not engaged with their health plan, but they are regularly visiting or engaging with the healthcare system, whether that be meeting with their PCP, OBGYN, pediatric provider, using the ER as their primary course of getting care. But again, this is another area that can be identifying behavioral health need and can get patients connected with us to ultimately deliver care. And then the third, which is, kind of a less of a focus for us, we really focus on, those people that are higher acuity and in higher need, which are, traditionally engaging with the healthcare system. The third is, those people that are self-navigating, and, they're going to the provider website, searching on the internet, trying to find, a provider that meets their need. And, we take patients from all three of these areas. The first two are kind of our core business.
So the payers in the Medicaid market, the payers that you mentioned are largely for-profit private insurance companies. Is that accurate? So
for-profit, not for-profit. There's a mix in there, but largely, there's a lot of national players that serve many states, and then there's a few regional players that are sprinkled in there.
So they absolutely care about, obviously, the cost of care, since they are holding the risk for this population. So talk about kind of that dynamic of, because this is a podcast where we talk about that counterweight of mission and margin. Clearly what you're providing, the services are much needed. There was a mental health crisis well before COVID. It was exacerbated by COVID. It continues to be a huge cost driver. People are going and seeking care in the wrong venues, really. We don't want them going to the emergency department if they're having a mental health crisis. We want them to the right place, right care, right time. So talk about that kind of mission and margin dynamic here, where you're clearly providing a service that meets the mission of what's needed. How do these organizations see the ability to sort of preserve or improve margins by managing this well?
Yeah, I think your point is a good one here, and if we take it even a step back from that, and how the Medicaid MCOs get their business, right? It's all through competitive bids with the state. The state puts out an RFP for to see who's doing what, and ultimately the goal of those RFPs is to allocate the membership to the health plans that are going to deliver the best care at the lowest cost, for the members that they serve. So that's really the ultimate driver that they're behind. So, what we want to do for them is be able to demonstrate that we can serve a large portion of their population, we can get them into care quickly, and we can deliver care outcomes for them that will, improve their bottom line, and that they can then write to, in the next RFP for why they should be serving, twice as many members than they're serving currently. But really our focus, when we think about that is, and where a big part of our value prop is we're outpatient care. So you mentioned you have a lot of people that are going to the ER for, med refills, or people are being discharged from an inpatient facility with no aftercare, only to end up back in that same facility 2-3 weeks later. So what we can really do is to provide a long-term stabilization for people that need help at that higher acuity level, where we don't want them using inpatient services when outpatient services are sufficient. We don't want the lower acuity people, going straight to the ER when a medication refill is sufficient. So it's really about, making sure we're operating at the, people always talk about operating at the top of their licensure, right? Like we want people to operate at the lower end of the acuity and align the acuity and need with the level of care that they're receiving. And there's a huge shortage in outpatient care to be able to support that. So people go where they can get it. And,
if we were having a conversation right now and you just flipped some of those conditions to, say, chronic conditions, diabetes, heart disease, same goal. We don't want people managing those conditions in high-cost venues. So I think one of the takeaways that I hope our listeners will hear from this is mental health is a condition. It's conditions that need to be managed. When we talk about population health, like this is one of the huge drivers of the high cost of care is when it's not managed well. And my hope is that we start treating this more like a chronic condition and a quote unquote disease than it's been treated in the past.
Yeah. Well, and I think we're also seeing a lot more of the adoption or acceptance that mental illness exacerbates all of these other conditions. You
100%.
see a much higher prevalence of mental illness in people that have chronic conditions like diabetes, heart disease, some of these other conditions. And, no one's going to treat their diabetes or care for themselves, and check their hemoglobin A1C and do all the things that they need to do if they're depressed, if they can't get out of bed, if they're not managing their eating habits, right? The impact of properly managing your mental health and getting into a good place there, we've seen have outsized results on, the physical health outcomes. So, if we're talking about whole person health, mental health is part of that, right? And the more that we can incorporate that in, I think the better we see. If you think about the whole person, whole system, right? Mm-hmm. That collaboration is really necessary to get the outcomes that we want.
Yeah, I absolutely agree, and I think it's been an interesting trajectory to see the recognition. Probably still not where it needs to be, but the recognition of the need to treat mental and behavioral health. And Jay, in fairness, the proliferation of tools out there. I think that's the other thing that has been a real positive is that there has been companies like Brave Health that are getting funded, that are innovating, that are building in this space, not just in Medicaid, but across the entire spectrum. And I just would add also, I love the fact that companies like Brave, and there's several others out there, are innovating within Medicaid itself. And for our listeners, I know many of us know this, Medicaid covers 70 plus million people. We are a population in the United States of 350 million. This is a substantial part of our population that deserves care, needs care, and innovations like what Brave is doing is a key component of making that population healthier, better, and productive citizens within our country. I'm going to go back to who you sell to. So you sell to, if you will, the health plan to be a part of their offering. Talk to me a little bit about what your team looks like. So you're the chief growth officer. Do you have a team underneath you that is going out, beating the pavement, talking to these health plans, pitching the value proposition for Brave Health?
That's right. Yep. So we've got a couple of different components that go along with that. So we have, kind of our team that's going out and executing those contracts and creating buy-in with those health plan leaders that, Brave should be part of their behavioral health portfolio, and that Brave can help support their members. And it starts with the contracting piece and then goes all the way through kind of implementation, where what that means for us is educating the people that are ultimately going to refer the membership to us. And then there's an account management component that comes on, right? These accounts can't stay in the BD side for forever. So then we get them transferred into an account management, which we need to ensure that we're hitting a certain level of service delivery, that we're providing value back to the health plans, and ultimately that we're sharing enough information to mutually improve our care for these members. And then we also have a marketing component that's making sure that we're keeping everyone up to date with what's going on with our programs that we offer, our care delivery, as that continues to evolve on both the patient side as well as the health plan or referrer side. And then there's also kind of getting down to like the layer below that is even, making sure that we're putting all of the information in the hands of the patient to make sure that they're getting to their appointments and attending.
Yeah. It sounds like you've got a pretty substantial team that is going out and engaging, building the value proposition, if you will. We're going to take a moment and actually thank a sponsor, the Echelon, that works with sales leaders, sellers in the digital health space, helping coach them, provide content. So let's take a moment and listen to what the Echelon does, and then we'll come right back.
The Counterweight is honored to be sponsored by the Echelon by Amy Teskey. The Echelon is intentional about building community and sharing expertise for healthcare technology sellers and leaders. The Echelon provides members curated content, educational materials, and the ability to connect with peers and leaders specific to healthcare technology. Sales can be hard. It is made easier when you are part of a community that is focused on enabling you to be your best. Take an opportunity to invest in yourself. Join the Echelon. Use the code Counterweight and gain the ability to participate for the first 30 days at no cost. Thank you to Amy Teskey and the Echelon for your sponsorship. Now back to the episode.
Well, welcome back. We're going to pick up where we left off. And Jay, you were talking about not just the go-to-market motion, so who you sell to, and certainly you had described there's first just really a landscape component of determining, qualifying, is this state available for Brave, meaning do the regulations or the payment mechanisms, et cetera, meet what you do today? Can you enter that state? Once that's a determination, you have a team that's going out and working with the health plans, you're selling, you're creating value, and ultimately trying to get them to include you as a benefit, if you will, out to the member population that they're taking responsibility for. Let's say for a moment, though, all 56 plans, because there's 50 states and 6 territories, by the way, for our listeners that do have individual Medicaid plans. Let's say all of those were an opportunity for you. Could you go sell all of those today, or do you have a counterpart that you need to balance with that is a critical part of how you determine how much can I sell versus how much can we service?
Yeah, so actually more than one counterpart and counterweight that we have to balance.
I like that. Yeah. Hashtag.
Yep. When we go and think about those new markets, so I think in most growth situations, we have to go and sell the deal and close it and get it through. But then there's delivery, right? Frequently we're not paid until there's actually delivery on the thing that we're sold. In software, this is, you sign the deal, you have to implement the software. In our world, we contract with the payers, and now we have to deliver care to the patients. So obviously, in order to deliver care, we need to have providers in order to do that. And we talked about some of the challenges of Medicaid licensing credentialing. That's one part of the story. The other part of the story is hiring and onboarding these providers. And really the push and the pull that we have and the puzzle that we work on when we think about growth and expansion is the balance of supply and demand. We in order to, one of the major challenges that we're having behavioral health in this country is there's a lot more people that need care than there is people to provide it. And, it takes 3, 4, 5 months to get an appointment. If we go into a market and we say, okay, great, we're here, but we haven't hired any providers yet. Now we have to go staff them. We have to bring them on. We're sitting there like everybody else, and we're not delivering on that value prop. So what we really have to do is make sure that we're bringing in our supply at the same time as demand, and then growing our supply in line with demand. So this puts a lot of or requires a lot of effort on both the supply side to be able to staff and forecast their ability to staff, with demand of being able to forecast, our ability to bring in patients, and then align those two when they're not necessarily on the same timeline. So that's really a huge challenge that we work on every day at Brave. Again, very fortunate to have and work with a phenomenal team that's very data focused and very focused on continuous improvement, learning from our mistakes, and continuing to evolve our process. But that's one of our biggest challenges when you think about the dynamic for care delivery and continuous growth in care delivery. I've dealt with that a little bit in my past around software, but I think, when you think especially about software as a service, a lot of times there are just dials you can turn and dollars you can pay, and, the supply just materializes, and it's just about having the capital in order to do it, and, and flipping the switch. It's not a, 6, 9, 12 month timeline, in order to think about what you need to do from a supply standpoint in order to make that happen, or to align, growth and supply.
Yeah. What's that? I mean, for those in chief growth officer roles, especially in fast growing companies, or companies who desire to grow fast, I mean, how do you manage those expectations with your peers, with your fellow C-suite leaders, to ensure that you don't create a mess that can't be addressed, and yet you've also got, we're here to grow, right? There's expectations to grow. So talk us through, like, what are your approaches there? What's worked well from a setting expectations and alignment perspective?
Yeah, I mean, I think it's important to have both a top-down and bottom-up strategy from this. You need to have your long-term growth strategy, and that needs to be driven by, law of large numbers and what you're able to achieve in that time period, and have predictable golden ratios that can give you directionally where you're going to be, within a certain confidence range. And that's certainly helpful at the executive level, at the board level, where, you can start to think about, what that growth looks like. But then you also need, a separate, hopefully similar, bottoms up model that can much more accurately predict, in the short term, what that growth is going to look like. That's driving much more operational decisions around, like, are we hiring 3 people? Are we hiring 5 people? Are we hiring 10 people? In order to support that, and do we have the confidence level necessary to make those choices? And what are our risk mitigation strategies if we come in above or below those? And what's the fallout for each of those things? But those are kind of the top down and bottom up approach. I think it's important to have those be separate, so that it's clear what the goal they're each trying to accomplish, and having the right tools for the right job.
Yeah. And so that's a constant string of communication. There's a continuous flow there, I assume, so that you're not going down the road too far and all of a sudden, we're way apart. So is that, I mean, from a practical perspective, you're talking about that weekly? What's that?
Yeah.
I assume? Okay.
Yeah, weekly. And I think it's helpful that, there's a very similar dynamic for us, at least on the supply side, where there's a pipeline, there's, pipeline ratios and conversion ratios that go along with it. So, just like I don't have 100% confidence in things that are going to close and exactly when they're going to close. And, we can put confidence ratios on all of those things. I have a counterpart that has the same challenge on the supply side where, you want to make sure that you've got the right size top of funnel that's going to produce, with enough volume, the output at the other side. Then we can really make those decisions at an organizational level of, do we want to err on the side of having more supply, to be able to handle that influx of additional demand, or do we want to tighten the belt and wait for the demand to come and then staff for it after? Or are there some contingency levers that we have that can get us from, to bridge the gap when we have those differences?
Yeah. So you've been with Brave nearly coming up 2 years, right?
That's right.
Touch on just in the same theme, as you entered into the executive team, are there things that you do deliberately to build that level of trust? Because, as you described that scenario, behind the scenes, you've got some pretty complicated levers that have to line up just right. And not to say it's always perfect, right? I mean, there's a process and these things have a way of working through, but I imagine your counterpart that is especially building all the staffing, going out and recruiting the providers, et cetera, they need to trust you. And conversely, when you get a payer on and you're going to go enroll these members, you need to trust that your counterpart has that taken care of, is going to be able to staff those providers. Anything that you leaned into to try to build that foundation of trust relatively quickly with your team?
Yeah, I think at the very top, it's communication and transparency, right? I think providing that visibility into what's working, what's not, and being able to have that that open line of communication and being able to share, where we might be stuck, where we might be blocked, where this things may be faster or slower than what we expect, is important. But then I think, being able to evolve the model and look at, what was the actuals, what did we think was going to happen, what actually happened, what did we learn, what are we going to do about it, right? To refine that, and, that kind of mantra is one that exists throughout our organization of, understanding that we're not going to know all the answers, and we're not going to be right all of the time. Hopefully it's most of the time, but when we are wrong, what can we learn from that, and how can we do things differently the next time around to get a little bit better, and that culture of continuous improvement, being able to learn from your mistakes and get better every day, find the next bottleneck and start to resolve it. Is one that's baked into the culture here that makes it a little bit easier to be able to say, I don't know, or this is what I think based on the things that I know today, and here's the assumptions that we're putting in to make this conclusion.
Yeah, good stuff, man. Just continuous improvement, communication, transparency. I know, like, these things seem simple. They're not always easy to implement, right? The concept's simple, like we're talking about it. Oh, this makes sense, right? Communication builds trust. But actually going and doing it can be very hard work. And you've obviously had a great career in healthcare, in leadership. You've had stops at McKesson. You've been part of some high growth companies. Has there been a time, Jay, when maybe something didn't go well, you were facing some huge, challenges, whatever that might be? What did you do? How did you deal with it? And how did you come out of it? And what did you learn? Love to, if you could share that with our listeners.
Yeah. Personally, I think one of the things that I've struggled with in my career. And, it's something that I have to think about on, probably not a daily basis, but I think about a lot because it's kind of a default mode for me is when, I run into rough spots or try to hit, or hit things that are difficult, to, kind of internalize and try to fix the problem and not, you know, find that solution and that right answer, and kind of wall myself off while that's happening. It's, I try every day, when I get into those situations to not do that. I don't think it's productive. And I don't think it goes against all those things that we just talked about, of having that open line of communication, that transparency.
Yeah. And that is hard, right? Because as growth leaders, we're expected to, there's a certain expectation of, hey, like you got to know what you're doing. You got to know how to solve some of these challenges. So I think just to dig into that a little bit of that sense of, okay, we've got this thing in front of us, this challenge, this problem, roadblock, whatever. Where does that tendency to want to isolate come from? Is that sort of the rugged individualism of, well, I just got to go figure this out. Let me go crank on this because that's what I did in the past when I was an individual contributor or whatever. Is it pride? Is it fear? I mean, what is it that holds us back from wanting to bring others in and wanting to communicate when things get hard? What do you think?
That's a great question. That's probably one that I'm going to have to spend some time laying on the couch to figure out.
Lay right here. I got a chair right here. I don't know. Yeah, I mean, to me, I just think it's a constant challenge. I know for me, the failures that I have had, as I look back, many of them were because I thought I needed to do something myself, and I would go kind of in my cave and go crank on it because that's what I was used to doing from being an individual contributor or whatever. Or maybe I was afraid that people would find me out, that I didn't know what I was doing. Like, wow, what if they figure out that I don't know all the answers, right? So I think it's a continuous thing for us to dig into as leaders of what is holding us back. Because when we don't bring others in, I don't know about you, but it hasn't turned out well.
No. Well, I've been fortunate enough to work with some leaders that are, haven't been shy about calling me on it when I do those things. And, I think a lot of it is about naming the problem, and this is both at the problem solving level of, right, like this is the problem and this is how we're going to do it. It's also at the personal level of, this is the problem that I'm creating by not working through this problem in a different and better way, and then being able to leverage the supports that are there, to solve that problem, because ultimately it's nothing easy. Otherwise, you wouldn't be thinking about it a lot and worrying about it, and having to spend a lot of time. Again, back to those core principles of that transparency and that communication. It's not always easy to do. It's really about making sure that you're living those principles and not just when it's easy, but also when it's hard.
Yeah. Well, and I think that's exactly what leadership is. And you go back, James, you made this observation. We say these words: communication, transparency, share, bring people in, etc. And they are easy things to say. They are hard things to put in practice, and they're even harder to do consistently. But true leadership is less about making sure everybody knows that you're the best or you know everything, and more about, can I actually empower this group of people to go faster than they could alone? And sometimes that's just simply, I have to acknowledge I don't know the answer. How can I bring people together to solve this problem, help them accelerate, etc.? Jay, I want to ask you, as you think about your team, you're in a growth organization, you've built a team. I imagine you're building a team. It's a constant iteration. What do you look for when you go out and hire? What are the traits when you interview or you bring a team member on, especially within your growth team, that are important to you? and you would encourage other leaders to be thoughtful of when they're evaluating or thinking about talent in that regard?
Yeah, I think about it kind of in two ways. One is, how are you engaging with the customer? Ultimately, your ability to engage with, understand, connect with, and solve the problems of the customer is what's going to lead to success in most sales and growth roles. So obviously having a good history of being able to do that is important. And then I think the second piece is really around continuous improvement. Being none of these processes are static. Your pitch is never static. Your problem solving is never static. The market is never static. So how do you take from the learnings from your last meeting, last pitch, last presentation, last sales cycle, and do better the next time, even if it's 1% better, even if it's one less meeting to get from, initial pitch to close, refining that one value prop to make it a little bit better. And continuously pushing on that. I think, I don't want somebody that's going to, here's the play, run the play. We're going to do the same thing every time, right? Like we want to get better every time. The market's always evolving. There's always another competitor that, if you're not separating yourself from them, they're gaining on you.
Mm-hmm.
Right. So, a little bit of healthy paranoia I'll add in there as well.
Yeah, good stuff. And as you so what I'm hearing there is engaging, building relationships, building trust with the customer and also with the team, right? It's a two-way thing there.
Absolutely.
And then continuous improvement. We're never done. We've never arrived. If we think we've arrived, we got a problem.
That's right.
So just that continuous improvement. Want to just take a moment, speaking of which, to just give a shout out to a couple of our sponsors, a couple more of our sponsors here. First, upper right corner, the upperrightcorner.com for any and all of your healthcare IT leadership strategy, go to market, go to network, interim leadership, growth strategy needs. Check out the upperrightcorner.com. Doug, you want to give a shout out to Waypoint?
Yeah, absolutely. Waypoint Healthcare Solutions is proud to sponsor the Counterweight, and Waypoint is focused on patient engagement, patient navigation, and helping health systems employ the best tools and technologies to provide that experience for their community. So, Jay, we're having a phenomenal conversation. I would ask, is there something that inspires you as you go? Because you've got a big job, you've got a hard job. Is there a podcast other than the Counterweight, a book you read? I mean, what gets you up in the morning?
Yeah, what
to go
fills your
tackle?
tank, man?
That's
How do
right.
you fill that tank? You got to go out and do all the great things you're doing. It's hard work. What's a tank filler for you?
Yeah, there's a book. There's been a lot of books that have been that are derivative works of this one. It's been around for a really long time. It's called The Goal. It's a 1980s book on the theory of constraints and continuous improvement. It was originally written, about a manufacturing company and the bottlenecks in that. There have been several derivative works from it, including the Phoenix Project, which is, a more contemporary version that kind of takes the same concept but applies it to software and IT. But a lot of those, problem solving, understanding where those gaps are, where those problems, bottlenecks are, and kind of pushing on, what are the limitations and what were the theories that caused us to make those decisions, and how do we challenge those to do things better?
That's phenomenal. We're gonna do a book review.
Book club.
Yeah, that's right. I made a note. I'm gonna go buy and read it. It sounds like a fascinating fascinating book. So thank you for that.
Yeah.
Jay, as we bring this to a close, we've covered a lot of ground. I wanted to say a shout out just once more though, to not just what you and your team are doing as part of the growth organization, but what Brave Health is doing. For our listeners, we can't have too much innovation in healthcare, and we can't have too much innovation specifically in Medicaid. It's a population that's been underserved, underrepresented for way too long, and it makes my heart warm to see organizations like Brave. There's several others out there in a variety of different spaces that are really breaking barriers to help people who are being served in those programs actually get care faster, better, and in ways that makes them healthier and productive individuals. So kudos to you, to Brave. It's just such an incredible and noble cause. With that, we're going to touch on really the noblest cause, the noblest idea, which is a question that our listeners really, they fast forward to the end of the episode. This is the thing they want to hear first. And remind our listeners, you're not in Kansas City, you're in the Boston metro area. Is that right? Kind of
That's
in the
right.
Boston. Yeah. So James is going to ask you something. It's a bit of a curveball. I think we're all going to be really interesting to see what you say.
I may do a two-part, because since you're not Kansas City based, so the question is, if you had to bring a client to Kansas City for barbecue, where would you go? But you may not know, so we'll give you a chance at that. But I'll turn it on to the Boston scene for a moment. There was a quarterback, I forgot his name. I think he won several Super Bowls back in the day. I must have been a while ago. Will any other quarterback ever exceed the number of Super Bowl rings won by that certain quarterback who played for the New England Patriots once upon a time? So either question, both questions, go for it. Our listeners are on the edge of their seats right now, waiting for your response.
Yeah,
I'm on the edge of my seat.
I'll hit the first one. This may not go over well for me for the Kansas City listeners, but my favorite barbecue spot, not in Kansas City, but kind of across the country, is Peg Leg Porker in Nashville.
Okay.
Peg Leg Porker. All right.
Okay.
I'm going to be in Nashville in a week. I'm going to go check that out.
Check it out.
It's a really good
Nashville
one.
shout out.
Yeah.
Yep.
Nash Vegas.
But and is it the sauce? Is it the meat? Is it like what stands out to you for, other than evidently some guy with peg legs walking around and serving all the food?
That's right.
Yeah.
So in Nashville, you don't do the sauce, so it's that's a dry rub state. So
all right,
gotta be careful there. But the ribs and the pulled pork, phenomenal. There. They will serve you the sauce, but you're gonna get a look.
You're gonna get a look.
Yeah, come on, man.
Yeah.
So I gotta check my Kansas City preferences and just order and not ask anything about the sauce.
Rookie.
Don't be
a tourist.
That's right. Yeah. And then the quarterback, the greatest of all time. I don't think it's possible for anyone to catch him. Really 2 full dynasties plus a bonus Super Bowl in Tampa Bay. Hard to imagine anyone getting there. Especially when you think about all of the quarterbacks that have tried to play past 40 and how many of them have been successful, in that 38 to 44 range, and what he was able to do, in that same range.
You're making the Jets fans who are listening, all 3 of them, you're making them really sad right now. So,
wow.
All right. Well, I know there's folks in Kansas City who might think there's a quarterback here who can do it, but he's got some work to do. So we'll see.
Yeah.
Love it, man.
It's going to be a journey.
Jay, this has been amazing. We hope you come back.
Please do.
And do this again. Thank you so much.
Yeah. Thank you guys for having me. Really appreciate it. Would love to come back.
Awesome.
Thank you for listening. We are excited to bring new episodes out each week. We are incredibly grateful to our guests and our listeners. Let us know what you think by commenting on the episodes. The Counterweight is honored to be sponsored by The Echelon by Amy Teskey. The Echelon is intentional about building community and sharing expertise for healthcare technology sellers and leaders. The Echelon provides members curated content, education materials, and the ability to connect with peers and leaders specific to healthcare technology. Sales can be hard. It is made easier when you are part of a community that is focused on enabling you to be your best. Take an opportunity to invest in yourself, join the Echelon, use the code Counterweight, and gain the ability to participate for the first 30 days at no cost. Thank you to Amy Teskey and the Echelon for your sponsorship. We are also proudly sponsored by the Upper Right Corner, which provides advice on strategic growth, including growth assessments and strategy, go-to-network planning, sales leadership, team coaching, and fractional leadership roles. For more, visit theupperrightcorner.com. Lastly, we are proud to be sponsored by Waypoint Healthcare Solutions. Waypoint Healthcare is a focused consulting organization helping health systems, providers, and organizations develop and implement patient engagement strategies. Waypoint HCS provides strategic consulting and patient engagement technology guidance and selection. Waypoint also helps support implementations and ongoing program management. For more, visit Waypoint HCS's LinkedIn page or waypointhcs.com. Thank you to our guests and our listeners. As always, you can find us on Apple Podcasts, Spotify, YouTube, Instagram, and LinkedIn. Subscribe, like, and follow, and we look forward to joining you again next Wednesday for another episode of The Counterweight.